What's up, fam? We are back with another episode of the Green Bay Health Project podcast. And today we're sitting down talking with Dr. Lindsay Seefeldt, doctorate of physical therapy, PT, at Uplifted Oncology Rehab, which she started, I believe, mid 2023, if that's
Yes.
correct, after quite a few years in the traditional setting. So I'm really curious to hear what made you want to branch out and do what you're doing because it's different, which I think is really cool and really needed in this area. Um, so, Lindsay, I appreciate you taking some time out, and I'm looking forward
Yes.
to talking more about what you're doing.
Yeah. Well, thanks so much for having me. Like you said, I kind of started almost a year ago, March of 23.
True. Yeah.
I've been a physical therapist for, gosh, almost 16 years now. And, the last 8 years, I really dedicated, my love and passion for working with individuals going through cancer and cancer related treatments. Um, and I'll kind of get more into like why I decided to branch off. But the real gist of what I'm doing is the soul is the cancer, and so I've got three main kind of branches that I do with my business. First being cancer rehabilitation, obviously from the name of my business, Oncology Rehab. Um, I help individuals go through, their journey, their cancer diagnosis, and many of them are participating with, many means to combat their cancer. Surgery, radiation, chemotherapy, a lot of times reconstructive type surgeries, and so a lot of this is happening within, anywhere from like a 1 to 2 year window. And it is brutal. These patients are going through some tremendous life altering changes, not only their body, but their mind and their spirit. And so by helping them through their process, we get the healing started right away. Sometimes, they're going through that journey and they're kind of lost in how, like, how should I do certain things? Like, how should I move? How can I help better my body? And so, that is one way, like, I work with my patients one on one, and I really help them, just help the healing process start so early in the beginning so that they have a quicker recovery and just a better chance to decrease like chronic issues in the future when they're through their treatment. So the second avenue that what I work with is management. Unfortunately, sometimes individuals going through, cancer will have some chronic long-term complications. Lymphedema being a big one. I am a certified lymphedema therapist. So I've been treating lymphedema for close to, I think about 8 years now. So I have a really in-depth knowledge about our lymphatic system and how to, decongest the body and teach you different strategies and tools that you can use at home to assist with that. So lymphedema being a very big one. Chronic pain, unfortunately, sometimes with the surgeries and radiation, it can create very painful scarring. And so I help assist with like their comfort and getting the pain more manageable. And then the third area that I really focus with my business is prevention. I absolutely love this. I mean, I think this is what has really driven me to kind of branch out on my own, because I feel like healthcare in general right now is so reactive, right? We
100%.
wait for yes, we wait for the diagnosis to come. We wait for the injury to happen. We wait for cancer to show up. Well, why
Hmm.
aren't we doing everything in our power to prevent it from happening in the first place? And so, with my lymphatic training, I've developed a program to, particularly for women right now with breasts, obviously, to do help with like self lymphatic treatment. So teaching women how to do self breast lymphatic drainage techniques, as well as teach them different exercises to help decongest that area, as well as increase that blood circulation to really help reduce that risk of developing cancer. So yeah, so prevention, rehabilitation, and management, that's exactly what I'm about here at Uplifted.
That's cool. Can you explain more about the lymphedema side of things and like exactly what that is? I don't know if everybody is super familiar with it and why it's
Yeah.
so one important and two beneficial to work on it.
Oh, absolutely. So, lymphedema is just a very fancy term for swelling, like stagnant, constant swelling that just pools and stays, in a location. So, when we're talking, like usually it happens, lymphedema usually occurs like two ways. Either there's some kind of trauma, or sometimes people are just born with a lazy lymphatic system. And so, you know, with oncology, it tends to be more due to the disruption from either the cancer or the surgeries or the radiation. And so usually it picks an extremity. So depending where the cancer is located, you can, develop lymphedema kind of in your upper extremities, like your arms, your legs is a common area. A lot of people don't know, but you can develop it in your tummy area and your back. And so, what I do with the lymphedema side is, I assess and look at where your trouble areas are, and then I help with decongesting kind of those trouble areas and find tools and strategies to help you manage it. And I would love to help you reverse it, especially if we catch it early enough. That's why I was talking about being very proactive with getting on board with treatment, because sometimes we can reverse lymphedema from like being chronic.
Yeah. It's it's something that we have it's a big talking point for us as well to, try to get on the other side of reacting. Like we don't necessarily want to, I mean, oftentimes, unfortunately people wait until something drastic or bad happens and then it's playing catch up. And then it's like, okay, now we can start to be more proactive
Yes.
as long as you put the fire out, so to speak. But what do you I'm genuinely curious with this. So, first question: what do you typically see in your setting with that type of mindset? Like, cancer happens. How can we help you along, and then eventually get to the point where, hey, we're being more proactive with your health? Obviously, there are so many factors I would
Mm-hmm.
assume that go into this, like treatment
Yes.
outcomes, type, location, all that stuff. And then the second question I have is you mentioned women and breast cancer, but what other cancers do you typically see and work with?
No, absolutely. Well, I think, along the lines of being like proactive. So like my patients, I generally like to see them as early as possible. So, truly the time of diagnosis, because there when patients come to me at the time of diagnosis, I can do a full body assessment with my patients. Like I know what their mobility is like. I know what their strength is like. I take a lot of measurements the first appointment. Like, so for example, if they have breast cancer, I tend to take measurements of their upper extremities so
Mm,
that down the line, I can go back to those measurements and say, oh my goodness, there's obviously a change going on here. So when we can have that first initial contact, then I have a true baseline, and I really pride myself at it, like especially with my company, I follow my patients through their entire journey. So it's not that I consistently see them week by week by week by week. Sometimes it's like touching point. Okay, I know you have a surgery coming up. Um, okay, we're going to kind of pause here until, once we have clearance by the doctor to kind of start some physical therapy. And at that point, we get in and I do a tremendous amount of hands-on type treatment with my patients. So, with surgery, there's scar
mm,
tissue going
mhm.
on. Your body will have an inflammation response. So you just can't stop that. That's just natural how we heal. And so inflammation is normal when you have surgery, but if it stays, that's not normal. So we have to help assist kind of push that inflammation out of there, so that helps with that healing. It decreases the risk of having any type of wounds that sometimes can creep up. And so, depending on, sometimes surgery is all my patients will have, if they catch it early, but, radiation is a very common one where you need to get in early with those patients. Uh, when you have radiation, there is a tremendous amount of scarring that can,
Mhm.
happen as a
Mhm.
result of the radiation, because radiation basically burns. Their goal is to burn that cancer, whatever little cancer cells might be lingering. And so when you have that radiation, it can scar that whole area. So if we can get that early hands-on treatment, I can help soften that tissue so that that lymphatic system can move more effectively so it doesn't get scarred down. Because if tissue scars down, it can create kind of that lag with that lymphatic mobility, and can increase the risk of developing long-term chronic lymphedema or
Mhm.
chronic swelling in different terms.
Yeah,
Yeah.
it's crazy the damage that does. Um, full just for transparency purposes, my dad went through throat cancer in
Mm-hmm.
2007, and so he was on his left side. He's good now, like cancer free, all that stuff, but the radiation has
Mm-hmm.
just reared its head now.
Yes.
Like he's what's this? It'll be 17 years. I'm not a math guy, but I think that's right.
Mm-hmm.
Um, and he's just having so many like neurological issues down his left arm and everything like that,
Yes.
just because of the being just
Mm-hmm.
blasted in his throat. Like,
Yes.
thankfully, it was a life. It was necessary. It was life saving. I mean, it was
Yes.
serious. It was very serious, and it was life saving. But there's a lot of issues going on now where it's like it's interesting because you get the diagnosis, and now on your end, people can be proactive by starting this stuff right
Mm-hmm.
away. So it's like
Yes.
it's dependent on how, in my opinion, how you view it. Like we're reacting to the cancer, kind of sure that's like the problem, that's what happened. But now starting with
Mm-hmm.
you is being proactive about it. So you're doing
Yes.
something
Yeah.
about it, which I think is really freaking cool.
Yeah, absolutely. Because, well, I mean, research shows that it's really sad with head and neck cancers. 90% of individuals with head and neck cancer will develop some kind of chronic swelling
Mhm.
in their head and neck. And so, with those patients, yeah, I work a lot with head and neck cancer patients. I help with a lot of, same thing like tissue, just working on that tissue to help everything stay mobile so it doesn't become so tight in their neck, which limits, their
Mhm.
neck mobility. I mean, think about like the throat. I mean, our swallowing function,
Right.
our ability to speak. So that is definitely one. I definitely work a lot with head and neck cancer patients to
Sure.
help keep that function and comfort, because it can be extremely painful, especially in that region.
Yeah. And with the like you had noted the scar tissue and from like post-op, how
Yes.
important is that to start working like the surgical site, scars, all of that into the process of healing?
Um, as soon as we have to kind of follow obviously the surgeon's guidelines, so I really work very closely with, like your oncology team and your surgical team when it's correct to start with the rehab. But, typically the ballpark is anywhere around like that 2 to 3 week
Okay.
benchmark after those
Post-op.
particular, yeah, post-op. So
Okay.
post-op as well as radiation. I'm trying I really try to kind of help them through the process of radiation to because your tissue starts healing immediately. I know you're getting, burned, for several weeks sometimes, but
Right.
it's good to kind of start that healing process during the radiation too. So yeah, typically it's kind of around that 2 to 3 week benchmark after you have, the procedures.
Yeah. Is that just to allow some repair and healing to happen before you kind of
Yes.
get rocking?
Yeah, absolutely. And not only for me to do, I do the physical
Hmm.
aspect, I do the manual techniques, but, education is so incredibly
Mm.
huge. Like I'm teaching my patients, okay, you need to be doing these certain stretches. You need to be doing these certain movements. You need to really replenish your body with wonderful protein and doing different things like that. And, if there's something that I'm not familiar with, I will find, like providers in our area. There are so many wonderful providers here in the area that do so many different things. And,
Mhm.
I am absolutely will refer out, if you're looking for something, because, the way you heal and the way I heal might be completely different. And
For
so,
sure.
I take that into consideration, as I'm helping my patients, find different ways to heal. Like, who can we refer you to that sounds like would be a really good fit for you?
Yeah, that's cool. So you see breast cancer, head and neck.
Yes.
What else?
I do well. I'm certified also, so these I've gone through certification courses to become a certified oncology provider. So breast is one area, head and neck cancer, pelvic and GI cancers. So this includes kind of all your gynecological type cancers, any type of intestinal, liver, kidney, all those and vital organs inside. And I'm also certified in like chemotoxicity. And so what that means is I've been trained in like different chemo drugs that patients go through. And so with each different chemo drug, there can be different levels of like toxic, like we call it toxic, like to our body. So it can be a cardiotoxic, which means it affects our heart. Um, just other, neurotoxicity. So that can affect like our balance system. So all those different avenues, I know how to correctly prescribe exercise to my patients. Like how safe is it to proceed with different forms of strengthening and conditioning type things.
Sure. That's really cool. Um, oh, I had a question for you. I can't remember it. Sorry about that. Um, what, so you said a lot of manual stuff. So
Mm-hmm.
I'm assuming, and correct me if I'm wrong, there's obviously a progression for this. So walk us through, and like you don't need to give anything away, but like what does a typical first visit look like? And then just a general outlook. Obviously variables differs person to person. But like what does that first time somebody comes in with you, what does that usually look like? What can they
Yes.
expect?
Well, I mean, I do a very thorough evaluation with my patients, and obviously with all the different avenues. I mean, they could be coming in, preventative side, they don't have cancer, or they could be having cancer and going through treatment, or the third is they already have gone through all the treatment. So I think I start with just a very thorough evaluation with my patients. So I sit down with them and, like I listen, like, okay, well, what kind of things are you concerned about? And I test, strength, mobility, balance, endurance, and I actually feel their tissues. So I actually look and feel it, like what's going on. And so from there, we make a plan, like a plan of okay, going forward, what we need to do. So yes, if they're going through the actual, the surgery and the radiation, they're actively having that trauma right now. So a lot of times I will be working with my patients, once a week, for a period of time until I do a lot of hands-on techniques, but then I'm teaching them ways that they can, carry this over at home. Um, and then sometimes we get to a point where they're doing, fairly well. Let's say they've, had surgery and that's all the treatment that they require. Sometimes, we just do a few sessions to get that tissue moving. And by them doing the stuff at home, we then maybe don't need to touch base for a while. Sometimes I always like to follow up with my patients down the road, just to make sure that things aren't getting worse, that they don't have any questions, and two, like figure out how to progress, right? So some individuals maybe need a little bit more help in different ways, like maybe need more of a personal trainer, or like maybe it's more of the mental side. Maybe
Mhm.
they need somebody to kind of help. Like talk with somebody, like find those support groups, or finding a counselor. And so sometimes, it's just kind of touching base, like how's life right now?
Mhm.
Maybe physically you're doing great, but mentally maybe we need some help. So, um, and it just, I'm always here. That's the beauty of like me establishing with my patients. Like, I know what you've gone through. I know what you're going through. If you need me at any point along the line, you just reach out,
Mhm.
and I am very happy to help you.
Yeah.
So
And
it's totally person by person,
yeah, and
how
I
we
think
progress.
that's what's so cool about, the private practice side of things
Mhm.
is we can give so much to everybody that works with us, right? I mean, it's not only, sometimes there's people that come in, it's like, oh, you're mentally not well, like what's going on? And the trust and bond that you start to form is like,
Mhm.
I think that's probably my favorite part about it is the trust that people give us and give you. And to your aspect, like how important education is always important. I feel like the
Mhm.
more educated people are about what's going on with their own body, it empowers them a bit. And we see that on our end, but like what do you see? Like there's always a transformation. I feel like when people first start, they're like a little hesitant, and then there's like that switch where it's like, oh,
Mhm.
this is working, like I'm bought in, I trust this. And then they start talking to you like, oh, this is what I'm feeling, this is what I'm doing. It's like, oh man, you're spitting back words that we talked about like maybe weeks ago, but like you're listening and buying in. So like I think the education component is probably one of the most important. What are your thoughts?
Oh gosh, yeah. I mean, that, that's, I mean, I love being like in that private practice because I spend very personal, close time with these patients,
Right.
and you develop such a relationship with them and their friends and their family. Um, like that, it is so important, that education piece, because I mean, it's their body, it's their body, and we have to help coach them like this is normal. This is what you do if you see this. So, like, oh, yeah, I remember Lindsay talking about that not that long ago,
Hmm.
so it'll trigger them to help better, they can take care of their health better. And
Hmm.
so, and if they've got that concern, they can reach out to you,
Right.
and we can kind of go from there.
And I love what you said too about like if you are unsure of an answer, like you'll figure it out, you'll find it and get back to them. Like I think that's humbling, but it's
Mhm.
also, it shows them that you're willing to admit like what you don't know, but you're also willing to do the work and figure it out for them, which again I think is invaluable, and it gets people to trust you, and it's super important. I can't imagine like working with cancer patients. There's so much going on. Like just through my experience with, family members and whatnot, like there's so much going on and so much change and fear that it's,
Mhm.
so to be able to help them in some capacity has got to be so rewarding.
It's just like that's another way I've driven to doing this on my own, because you develop such close relationships, and to see them start from the beginning and go through something horrific as cancer, and
Hmm.
then see them on the other side where they're healed, and like they're back to living their best life, and knowing that I helped them get to that
Right.
point is just like, I can't even put it into words how amazing that is. And it's, like I said, they're like family, it's
Right.
just like I so excited when they get to that point. I'm so happy for them to just like dust off cancer and just go on living life again.
Yeah,
So it's so rewarding what I do.
I bet. I bet it is. That's awesome. Um, so we kind of touched on, what you work with, who you work with. You said you've got some program.
Mm-hmm.
Tell me about that.
Oh,
Tell us
yes.
about that.
So this is, I'm still developing my different programs, but, like I talked about the preventative side, and,
Hmm.
if we can prevent cancer from happening in the first place, fantastic. And
Right.
so with my lymphatic background, I've started off doing this breast self-lymphatic massage and exercise program. And so I am planning, I host it at my facility. I'm hoping to do like 2 to 3 classes a month. It's an hour-long class, and it's all about teaching women how to do a self-breast lymphatic massage and what movements to do to kind of help stimulate that as well. And so, this is for, like, the women that I tend to see are, like if you've got like that breast cancer history in your family, if you have um, very dense breast tissue, if you have occasional pain in your breast, sometimes at the, like when they do a mammogram and other imaging, they can detect that you maybe have a cyst or areas of inflammation in that breast tissue. And so, unfortunately, inflammation cancer loves inflammation. It loves stagnant fluid that is just hanging out there. And so if we can create like a better breast environment by moving, some of that lymphatic fluid out of there and teach you how to move correctly, that'll keep a healthier environment. Obviously, there's more to it than just doing that. I mean, you have to have, just different lifestyles and keep active, reduce stress, better sleep. But this is just one little like program that I've developed to just really educate the women in our area on how to, take care of their breast tissue.
Is that up and running?
It is up and running. I had my first class, last week, and it was fantastic. It's a group of, I can have up to 10 women. I think I
Okay.
had 6 there last week, and
Nice.
it was, just, all the women there were very excited to learn
Mhm.
how to do this technique at home. And because they're taking that proactive approach, like they've got some of that, family history, or they have had some issues with their breast tissue. So they're taking that proactive approach to try to reduce their risk of developing cancer down the road.
Where can people go to see more info about that?
Yes. I think the best, I do post a lot on either my Facebook page and Instagram, all about, like, I've got flyers on there, or, honestly, just reaching out to me. Because like I said, I'm hoping to do this every single month, having
Mhm.
different classes. So if people just reach out to me, I can let them know kind of when I'm holding my next classes. So
Okay.
this is definitely something I plan on continuing to do here.
Okay. So the easiest way to find out, either follow the socials or reach out and
Yes,
find out
personally.
dates.
Yep. Yep. Find out dates. Yep.
Okay, cool.
Absolutely.
Perfect. No, that's really cool. Again, it goes back to that education piece, right?
Mm-hmm.
Like the
Yep.
more you educate, the more empowering it is. The more empowerment you have, the better the people usually do, better outcomes,
Mm-hmm.
typically.
Absolutely.
So I
Yep.
think that's super cool. Um, what else do you want us to know? We've covered,
Um,
we've covered.
it's just, yeah, I mean, I'm just like super stoked, to have my business up and running. And I've, already made some wonderful connections here in
Mm.
the area. And I love learning as I go here, like who's in Green Bay, our Green Bay area, that, can also assist, my patients as well. And I just, I think the biggest thing, the biggest takeaway is, be that proactive person, be that proactive for prevention, be that proactive, get in and see somebody if you're going through cancer, and then don't suffer. If you've had cancer many years ago and you're suffering, reach out, experience something different. And, hopefully I will be that one to help you.
Yeah, no, that's really cool. And if people want to uh contact you, like you mentioned the socials, and we'll be sure to link to this, all of this. What's the easiest way? What are maybe like your social
So
pages, your website, what you
yes, I would say like my website. So if you go to upliftedoncology.rehab.com, I have a contact button on the top of my screen. And once you click that, you can easily fill out your contact information, and you can even leave me a little message there. And then I'll get back to you promptly. So that's probably the easiest way. And all over my social and my website, there's my number there too. So feel free
have?
to, give me a call or shoot me a text.
Yeah, and like I said, we'll be sure to link to all of that. I remember my question I wanted to ask you. I know we're dialing down here, but um ages.
Yes.
What do you typically see? And what
Um,
what can you see? Like what are you comfortable with? Like
oh
what can
goodness.
people do?
You know, I would say, roughly, I think unfortunately, the youngest client I've worked with is age 23 with breast cancer. And so
Jeez.
I know, 23. Um, so I've worked with anywhere from 23 way up in ages,
Sure.
but cancer can affect, I mean, it's, even the little ones. I
Yeah,
have worked with a 10-year-old with a blood cancer once. And
that's what I was gonna
yeah, yeah. So I've worked with some young ones too. And, if, if I don't feel comfortable, I will definitely refer you out. But yeah, a lot of times it's kind of, like kind of that 20s all the way up. That's
say. Yeah.
typically the ages I work with.
Okay. Perfect. That's what I thought, but I wanted to make sure we asked and clear that up because like you said, it impacts it can any age at any point in time,
Mm-hmm.
which is
Mm-hmm.
awful. It scares me, honestly.
Mm-hmm.
It's a scary, scary thing. Awesome. Anything else?
I don't think
I
so.
Yeah, I really appreciate your time. This was super informative. And just thank you. I mean, I think you spread some knowledge about one, what you do, but two, a lot of education again, which is super important. So I really appreciate your time, Lindsay.
Yes, and thank you.
Awesome. Awesome. All right, guys. And we will talk with you next time.